There's a position most older men use unconsciously, and it could be silently harming your prostate, crushing your circulation, and setting you up for future sexual problems. And no one talks about it because no one thinks this matters. But the science says otherwise. If you're over 60 and you still masturbate lying down on your back, this might be the most important video you'll watch all year. As we age, everything in the body changes. Muscle mass shrinks, hormones fluctuate, and perhaps most importantly, circulation slows down. But what most men don't realize is that blood flow doesn't just affect your heart. It directly impacts your pelvic health. That includes your prostate, your erections, and even how well your body can make testosterone. Now here's the part most people miss. If you're stimulating yourself while lying flat on your back or curled up slightly in bed, you might be unknowingly making things worse. This isn't just about comfort. That position actually pinches off the key blood vessels and puts direct pressure on your pelvic floor, right when your body needs open flow the most. Over time, that small habit may contribute to weaker and shorter lasting erections, tight, overworked pelvic muscles, poor signal from your brain to your reproductive system, and even increased risk of chronic prostate pressure or inflammation. The scary part, it usually happens slowly, quietly. Years of poor posture during private moments may eventually show up as dysfunction, and by the time most men notice, they assume it was just aging. But what if it wasn't? A surprising 2021 study found that pelvic floor pressure was more than 3 times higher when lying flat than when seated with a straight spine. 3 times. That kind of pressure creates stress your body doesn't easily forget. And what's worse, most men are doing it without realizing it. Stick around, and I'll walk you through the exact position that may silently harm your performance and the simple way to fix it starting today. Let's take a step back. Your body after 60 isn't the same. Testosterone tends to move lower, but your resilience, vascular health, and sensitivity all depend heavily on one thing: circulation. Less circulation means less oxygen gets into your pelvic tissues. Less oxygen means a slower, stiffer response. Not only sexually, but even in higher muscles work. The problem? Most men don't realize the way they position their bodies during arousal moments directly affects circulation. When blood vessels are compressed like they often are in a reclined or bent position, it's like stepping on a garden hose. You might still get flow, but it's restricted, weak, incomplete, and there's more. When you're lying down, especially in a soft bed or couch, your hips usually fall into what's called a posterior tilt. That means your pelvis curls under your spine. It feels relaxed, but here's what it really does. That tilt pushes weight down into your sacrum near your tailbone and forward into the soft tissue around your prostate and bladder. It also tightens up the small support muscles underneath you, especially the deep pelvic floor. Now imagine doing that with added arousal. Increased blood flow rushing in, muscles tightening, signals firing, but the whole area is compressed, swollen, and stuck. Studies from sources like the Journal of Urology have found that prolonged sitting or lying flat during moments of high pelvic activation may increase the risk of chronic pelvic pain and even nerve irritation. In plain terms, posture isn't just comfort. It's crucial to how your nervous system, especially the part responsible for sexual function, actually performs. And if nerve signals can't travel cleanly from your spine through your hips, your body doesn't respond the same. It can mean delayed arousal, weaker quality, and less confidence. Not because something is wrong, but because the wires aren't plugged in properly anymore. And yet, so often men are told it's just age. That's why today's message matters. We need to understand one thing: decline isn't always due to time. It's often due to tension. And tension builds up in areas we don't even think about, especially when we're alone, relaxed, and following years of unconscious habits. Here's the real kicker. The body doesn't just age. It adapts. If you've been using the same position, reclined, curled up, or slouched for years or decades, your soft tissue begins shaping itself around that habit. That includes blood vessels, nerve channels, and connective tissue in the pelvic floor. But adaptation isn't always a good thing. Too much pressure on one zone, especially near the prostate and tailbone, can slowly reduce sensitivity. It can also make the area stiff, as if it's always slightly sore, even when you're not aware of it. That stiffness increases the odds of future inflammation, which then leads to less function, which causes more frustration, and the cycle continues. But here's the good news. If the body adapts through daily posture, then it can also adapt in the other direction if we change the position. Think about it like this. If you keep driving your car with the tires slightly off balance, you'll feel a slow pull to one side. It won't blow out immediately, but over time, the wear increases. The alignment gets worse, and eventually, there's damage. Change the balance early, and the car lasts much longer. Your pelvic system works the same way. This is why today's core solution is surprisingly simple and powerful. It's not a pill. It's not a supplement. It's changing the way you position your hips during solo activity. Specifically, moving into a neutral pelvic posture, either seated upright with your spine aligned or standing with soft knees and hips in line with your shoulders. Even small tweaks like sitting on the edge of a chair instead of slouching into a couch can significantly reduce pressure on your prostate and improve blood flow during arousal. And once that blood flow opens back up, things begin to work better. Naturally, this isn't magic. It's mechanics. In part 2, I'll break down exactly how this posture works, the changes it creates, and a real-life story of a man who improved his performance in just 3 weeks, simply by changing his angle and opening his hips. This might be the most overlooked change any older man can make, because no one teaches us this. And yet it could be the key to restoring a healthier, more active sexual self even without medication. So stay with me, because after years of unknowingly creating tension, the most powerful shift you make might start by sitting a little differently. Let's talk about that small shift, because once you understand it, it starts to make a lot of sense. One man I spoke with, a 67-year-old former engineer named Tom, had been dealing with declining sensitivity for nearly 5 years. No major medical issues, no heart disease, but things just weren't working like they used to. His doctor suggested hormone tests. Everything was low normal. They gave him pills. Temporary help, but the root cause stayed untouched. One day, after doing some reading on pelvic alignment, Tom decided to experiment. Nothing drastic. No yoga mats or weird gadgets. He simply changed the way he sat. Instead of lying back in bed, he tried sitting upright on a firm surface, spine tall, feet flat on the floor. No slouching, no tipping backward. Just a tall seat where his hips sat even with his knees. Within 2 weeks, things started to feel different. More sensation, less tightness. But here's the surprising part: he wasn't feeling stimulated more. He was feeling less blocked. By week 3, he said it was like the lights turned back on. This wasn't a miracle. It was mechanics. You open the flow, you reduce the pressure, and suddenly your body remembers how to respond. Doctors who specialize in men's pelvic health, yes, there are such things, will tell you the same story again and again. It's not just chemicals. It's structure. In fact, a small review out of the UK in 2020 looked at men with chronic pelvic tension. Many had persistent issues despite normal testosterone levels. What helped? Postural retraining. Not yoga. Not deep therapy. Just learning to align their hips in a neutral way. Sitting tall. Stepping lightly. And keeping pressure off the floor of the pelvis during key moments. That's why the seated or standing position works so well. When you sit tall, your spine supports you instead of collapsing over the pelvis. Your pubic area lifts slightly, relieving pressure. Even standing, as long as the knees stay soft and the hips stay neutral, can allow full blood flow to reach the tissue below your waist. It gives the nerves room to communicate. It gives the muscles space to relax. Compare that to lying back on a soft bed where your hips sink and your lower spine curls. That soft curve might feel relaxing, but to your nervous system, it's confusing. It's like trying to make a phone call through a bent wire. The signal might get through, but it's fuzzy. It drops in and out. You can't always trust it. Now think about what that means over weeks or months. Your brain gets used to that fuzzy connection, and eventually, it stops dialing in with the same strength. So the fix isn't just about comfort. It's about reconnecting those signals again, clearly. Another simple strategy? Just lifting your hips slightly with a rolled towel when seated. It tilts the pelvis forward gently, opens everything up just a little more. And that little openness makes a big difference. One physical therapist who works with men over 60 said this: when you change their position, you change their outcome. You don't need stronger muscles. You need better coordination and less pressure. This is something we weren't taught as younger men. Most of us figured pleasure is pleasure. Whatever feels good must be fine. But as the years go by, that pressure adds up. And now we know better. Here's an image that helps explain why posture matters. Picture a garden hose running up a hill. If you press your thumb into the hose at one point, even lightly, the water slows down. No matter how strong the source is, the flow gets choked off. Now imagine unblocking that hose. It doesn't just spray better, it works like it was meant to. Your circulatory system isn't that different. Restrict it slightly, and everything downstream is affected. Which brings us back to hope, because this isn't about loss. It's about rediscovery. Imagine how different it would feel not just physically, but emotionally to know that your body is finally getting the flow it's built for. Imagine feeling a little more alive, a little more responsive, not with drugs, but with posture. That's power. And that change? It doesn't cost you anything. No doctor's visit, no pharmacy pickup. Just a few inches of movement, a little awareness, and consistency. Every time you change the way you sit or stand, you're giving your body a new chance to reset. The results? Less pressure, better signals, more control, and maybe, for the first time in a long time, a real sense of confidence again. Tom described it best. He said, "It wasn't like I became a teenager overnight. It was better. I felt like me again, just more awake." That's the feeling we're working toward. So here's what I want you to try just once this week. Next time you're alone and in a private moment, pay close attention to your posture. Sit upright or stand comfortably. Keep your hips aligned. Let your spine support your torso. Avoid slouching. Avoid tilting. And especially, avoid curling your pelvis under. As awkward as it sounds at first, you'll get used to it quickly. And over time, many men report a kind of unlocking feeling where things feel easier and better. Now, if you're wondering how this links to long-term prostate health, or how these same adjustments may impact other issues like frequent urination, nighttime waking, or pelvic soreness, I'll be covering all that in the next video. Trust me, you don't want to miss it. Because this one course shift changing your angle might be just the start of something even bigger. Hit the subscribe button so you don't miss part 3. And if you know a man who needs to hear this, share this video with him. He might think it's just aging, but now he'll know better.